So hello, my name is Sal, and I'll be giving a demonstration on how to scan the kidneys as well as the bladder. So today we're going to use the curvilinear probe first, because we're going to do a kidney scan. First thing that you have to do is make sure that the bed's height is something that is comfortable for you, because you'll likely be here for about 10 minutes. And if you're bending over the patient, you want to make sure that your back is not compromised. So here we've got our patient, and I've exposed him such that I can see the lateral as well as posterior aspect of his lower torso. That's all the window that I need to do a kidney scan. So first, I want to orientate to make sure that I know which side of the probe is left. Is the left of the screen, which side of the probe is to the right of the screen. So then I can decide where I want to put the probe, keeping in mind on previous lectures that the kidneys are very posterior, and you want to aim for the posterior axillary line. So you just come closer a little bit. So this will be your mid axillary line. That here is your anterior axillary line, and here's your posterior axillary line. I want to make sure that my probe is on the posterior axillary line. First thing you want to do is make sure that your knuckles are on the bed. You just come closer. So make sure your knuckles on the bed, and you place the probe on the posterior axillary line. I'll put my finger here just to make sure that I've anchored to the skin, and I know that my image or my probe is not drifting. Okay, so once I'm happy with the position that I'm in, I also have to take note that once I aim for the posterior axillary line, in terms of the height of which I put the probe, I just aim for where the ribs end. So the rib cage ends roughly here, and I put my probe just where the rib cage ends. Okay, so let's just refer back to the screen. So here I want to make sure that I've got enough depth so that I'm not missing any structures. And the first thing I look out for is the liver. Okay, so here you can see this coarse grainy appearance, pockmarked appearance, that's the liver. Very distinct. And to the left of my screen, I know if I go up, that's the lungs. You can see the lungs peeping in. And if I go, once I found the liver, I know that if I go to my right side, they're already peeking into the screen, is the kidneys. So I want to slide my probe down. So I'll slide my probe down so that to make sure that the kidneys is in the middle of the screen. Now you see here that there's a rib shadow that's blocking your image. Now that doesn't immediately matter. You can always shift your probe to compensate for that rib image, for the rib shadow later on. But for now, what I want to focus on is having that kidney in the middle of the screen. So once I found the kidney, the next thing I want to do is make sure that I have got the kidney. I got an image where I slice the kidneys in half, and I'm going through the middle of the kidneys. And also making sure that I've got the kidney, I've got an image that represents the longest length of the kidney. So I want to do this by doing a couple of things. So if you can just direct you here. So first, I want to do some fanning motion like this, or rotating motion like that, just to make sure that I find the true length of the kidney. So let's just go back there to the screen. So again, kidney in the middle of the screen, and I've made sure that my kidney fills the entire part of my screen. I can always adjust the depth a little bit, but actually I'm happy with what my depth is just now. I can play with the gain a little bit. This is too much gain, too little gain. I think this is just right. Okay, now I'm rotating, trying to find the longest length, and I'm fanning at the same time to try again to find the longest length. And I'm happy that this image here, it represents the longest length. So what I do next is this button here. Press freeze. Okay, so there you can release your probe, and your image will still be on the screen. And what you want to do next is then measure the length of the kidney, and you do that by this bottom left button here. Measure. Press that. Cross comes up. Drag that to the superior pole of your kidney. Press set. Second cross comes up. Drag that one all the way to the inferior pole. Press set, and there it tells you how long the kidney is. the kidney is in millimeters. That's 12 centimeters. Okay, great. And so the next thing I can do whilst I'm here is measure the cortex of the kidney. So I can press measure again, and that is defined by the depth or thickness between your capsule layer and the base of your pyramid, represented by this anechoic structure here. Set, and there it's 8.9 millimeters. Remembering that the normal range is between 7 to 11 millimeters. So that's normal. Okay, so good. So we have, and again, from this image, I'm just actually going to unfreeze it and have a look at the kidneys again. So again, trying to look for my liver and then find my kidneys. Now what I'm going to do is I'm going to fan through my kidney. I'm going to increase the depth a little bit so that when I fan through, I don't lose any image of the kidney. And what you can see here, I just want to point out, these anechoic regions are your medullas. And if you just focus on this one here, if I fan through his medulla, you can see that bright bundle that goes across to the top, right there. That's your arcuate vessels. That's how you know that this anechoic region is not a cyst. For anyone, you have between 7 to 18 of these pyramids. Okay, so fanning through. Okay, and I'm happy that I don't see any other pathology at all. Again, appreciating that you cannot see any dilation of the pelvis, neither can you see the ureters. And you shouldn't be able to see your pelvis or your ureters in a normal scan. If you can see them, that will represent hydronephrosis. Fine. So once we're happy with the longitudinal length of the kidney, what's important is, if you scan here, is that you rotate your probe 90 degrees. Okay, and if you point it there, so this was the image before. Once I rotate my probe, cross-sectional image. And what's important to do is to scan up through the entire length of the kidneys. This is especially useful whenever there's a cyst or abnormal space-occupying lesion, and you might be able to tell, you might be able to define that lesion better by scanning through here. And if I just point back towards here, I'm doing that by just fanning the probe like that. Okay, making sure that my hand is always anchored to the skin. Okay. So that is how you assess the kidney. So if I just go back again to the image, what you can do as well is put, let's say you find a anechoic region, what looks like a collection. What you can do is that you can put Doppler on it, you can put color, and that's represented by the CFM right here. You press that, a window comes up. You can drag the window anywhere you want. You can make it bigger or smaller. Okay, and then immediately you can appreciate this blood flow going through the kidneys, and that's a very healthy perfusion. Very healthily perfused kidney. Okay, fine. Okay, so that is the right kidney. So how do we measure, how do we find the left kidney? So this might be a little bit awkward. So if we get you to just go the other side. Thank you. So this sometimes requires you to almost do like a mini cuddle of the patient. So you put your hand around. Again, the principles apply. Knuckles to the bed, posterior line, keeping in mind your left kidney is going to be a bit higher than your right kidney. Place the probe roughly where the rib cage ends. And what you're looking for is the spleen. If you look at this image here, very beautifully, you can see the spleen coming into place right there. If you go further up towards the head, that's your lungs. You can see, if you can take a deep breath in and out, you can see the lungs peeking in and out. So that's your spleen. Thank you. And if you scan downwards from the spleen, that should be your kidney waiting to come into view. Okay, so there's your kidney. Now, again, you can see that there's a rib shadow over there. What you can do is that you can put your probe down a little bit and scan upwards. So you try to scan sort of underneath the rib cage, if you like. And you can see there the rib cage, depending on his inspiration expiration, comes into view. The kidney comes into view quite nicely. Okay, so if you hold a deep breath in and hold and press the image, there I've got a great image of the kidney. Just continue breathing. Thank you. So that's some techniques to try to optimize your image, especially when you've got structures such as your rib cage or bile gases that gets in the way. You can always shift your probe and try to find that window that will help you get the best image with. So, and you get more and more comfortable with that the more scans that you try. The more scans that you do. So just pick up the probe as much as you can. Okay, so that's the left. So once you find that left kidney, you do exactly the same thing as we described on the right kidney on the left. Okay, you fan through longitudinally and you look cross-sectionally as well. So fine. So then you've done the kidneys. Next thing you want to do is then you want to look for the bladder. The bladder is best looked for when the patient is lying flatter. It's actually easier because you sort of take away, especially if you've got a patient with a higher BMI, you can take away all the skin fold. So I'm just going to put the bed down flat. Okay. So we're now going to look for the bladder and do a bladder ultrasound. The best landmark to find the bladder is really to find your pubic bone. Or if really sometimes I just try to scan as far down as I can get. Sort of patient allowing or sort of clothing allowing. So again, making sure that my orientation, the probe orientation, faces the right of the patient. I'm going to put my probe in a cross-sectional orientation. I'm going to scan down as such, okay? And I'm looking on the screen for my bladder. You can see here, very nicely, the bladder comes into view. Once I find the bladder, I just need to fan, as you can just fan up and down to make sure that to assess for any abnormalities. Okay, and there isn't. Sometimes if you have got a catheterized patient, you might be able to find the balloon. So once I'm here, what I want to do is try to measure the bladder volume. And you want to do that by measuring the length, breadth, and height of the bladder, as I had talked about in the previous presentation. So what to do first is, whilst I'm in the cross-sectional view, I'll just fan up and down until I find the largest surface area. Okay, scan up and down, and roughly, I think I'm happy that this is the largest surface area. Freeze the screen, and then I'll measure the length and the breadth. So exactly, again, you press measure here, bring the cross to the edge of the bladder, and then I'm going to set. That's 8.3 centimeters. And I'm going to measure again. Measure the breadth. Okay, that's 6.4 centimeters. Then now I want to find the height. So what I'll do next, then, is I'll come up to the screen. This time, I'm going to rotate the probe 90 degrees, such that I'm looking at the bladder longitudinally. Pardon me. So that's the bladder in the longitudinal section, longitudinal plane rather. And again, I'm fanning left and right to make sure that I find the longest plane. Okay. And once I'm happy that I found the longest plane, I will then freeze the image, and then I will measure the length. So Measure. Set. Set. So that's 6.5 centimeters. So the volume of the bladder will be 6.5 centimeters times 8.4 centimeters times 6.5 centimeters times half. So length by breadth times height times half. And that will give you the bladder volume. Okay, once I'm here, so that's the bladder volume. That's how you measure the bladder. That concludes this demonstration, and I hope you've learned something from it. I'm always around to help out, or if you have any questions, please don't hesitate to get in touch with me. Thank you.